Hello and welcome to this fourth video in the series Flawless Aesthetics Botox Mastery 1.0. So far in the previous videos, we have discussed the importance of the consultation, counseling, and assessment and analysis and how important it is in your treatment procedure planning. From this video onwards, we'll be talking more on the injection techniques. So let's get started. So first things first, we are talking about, the glabellar complex. Now, what exactly a glabellar complex is? So glabellar complex is a combination of lines and folds in the medial, in between the two eyebrows. So in between the two eyebrows, we see one horizontal line and few vertical lines. And these all together, they form the glabellar complex. So in the picture, you can see the blue stars, they represent the area, or they denote the area what we call as the glabellar complex. Now, the glabellar complex is comprised of three muscles: procerus, corrugator supercilii, and depressor supercilii. And mostly we are dealing with the procerus and the corrugator supercilii while injecting Botox. Depressor supercilii is rarely, dealt with, and it's rarely required to inject that muscles, only in a very few cases, which we will discuss when we come to it. So knowing about the underlying anatomy is very important while injecting Botox. So let's talk about the muscles which are involved in the corrugator, in the glabellar complex. There are two muscles. The first one is the procerus, which is a thin pyramidal muscle, and the origin is from the nasal bones, and the insertion is into the skin of the glabella in the mediofrontal region. So its origin is from the nasal bone and it's over here. So it's a very thin pyramidal muscle. And the important things again about the Botox injection in the upper forehead is that here we are dealing with the muscles of facial expressions, and the muscles of facial expressions are important in the sense that origin is from the bone like any other muscle, but the insertion is into the skin. Usually in the body, the muscles originate and insert into the bone. But here we are dealing with muscles of facial expressions. They are different from other muscles in the body. Their origin is from the bone. Their insertion is into the skin, because of which their contraction causes the overlying skin fall into creases. And that is what are, leading to the formation of wrinkles and fine lines. And that is what we are dealing with when we are injecting Botox. So when we talk about procerus, the green muscle that you see over here in the picture, its origin is from the nasal bone, insertion into the skin of the glabella in the mediofrontal region, and its action is depression of the medial head of the brow. It depresses the medial head of the brow, and it is responsible for the horizontal lines between the eyebrow. So here another thing which is very important and which will keep coming again and again is also that the formation of the wrinkle is perpendicular to the line of action of the muscle fibers. So if the muscle fibers are vertical, the wrinkles overlying it, or the wrinkles which are formed by these vertical fibers, will be horizontal. So always remember, and I will repeat, that the wrinkle formation is always perpendicular to the line of action of the muscle. If the muscle fibers are vertical, the wrinkle formed over it will be horizontal. And if the muscle fibers are horizontal, the wrinkles formed here will be vertical. So there's a 90-degree relation between there. Next thing about procerus is that it's deep in the nasal region and it's superficial upwards. It's longer in women as compared to men. The next muscle that we deal with while injecting the glabellar complex is the corrugator supercilii muscles. Now, it forms a vertical forehead line in between the two eyebrows. In between the two eyebrows, there are some vertical lines, and that is responsible. So the vertical lines in the glabellar complex are because of the corrugator supercilii, because the horizontal are more or less because the course of the muscle, the fibers are more or less horizontal. So the wrinkles which are formed are vertical. So it originates from the frontal bone, 5 mm from the midline. It lies deep to the other muscles. It's very deep. And it inserts into the skin beneath the frontalis, that is 42 to 45 mm from the midline. And it is 5 to 8 mm deep under the skin. And narrow, it's a very narrow muscle, and it has no bony attachment laterally. So the medial aspect, the insertion origin aspect is the medial, it is called the head of the corrugator, and the insertion aspect is called the tail of the corrugator. So in the head region, medially, where it originates, it's deep. Obviously, it is originating from the bone, so it has to be deep. And then the plane changes and it travels superficially to insert into the dermis. And where the tail is there, the insertion point, there it lies very superficial. Now, there are various patterns of corrugator. It could be a U pattern, it could be V pattern, omega pattern, reverse omega pattern, horizontal 11s, and midline 1. So different people form different wrinkles depending upon the usage of their muscles. And it's, sometimes they call it hereditary also. But the important thing is that no matter what the pattern is, usually the injection points remain the same. So the corrugator patterns do not influence the points of injection that are recommended by allergen. Now, this is the Glabellar assessment scale. That is, it says that the muscle mass is more important than severity of frown line or wrinkles. So this is something more of a theoretical value. Clinically, it does not, hold. But then in the beginning of your, few earlier sessions, if you can ask all these questions to yourself and answer these questions before injecting Botox, it'll help you gain more insights. Although the injection patterns are same, the dosages are same, nothing changes because of these. But still, it will be good if if you can answer these questions while analyzing and assessing. So first, you have to know how much is the wrinkle depth and how much is the depression when the muscles are falling into action, how deep the wrinkles are, and how much brow depression. You ask the patient to contract and relax the muscles. You see the muscle action and see the brow movement along with the muscle action. Is the brow moving downwards? Is it remaining horizontal while the muscle contraction? Now, interbrow space, how much the interbrow distance changes from relaxation to full contraction. So from relaxation to full contraction, is there any change in the interbrow distance? Then the third thing is the glabella muscle size and shape. Sometimes when you ask them to contract, the glabella head is very prominent while the tail you can't even see. So just see. And in case if the tail is not seen, then you have to inject very, very, very superficially, and maybe you can omit that point also at some times. And are the glabellar muscles bulging at the point of maximum frown? So you need to inject wherever you find the maximum frown. The shape and position of the brow, because any kind of asymmetries have to be addressed before injecting, lest you want to, you cannot ignore this. The asymmetries should not be ignored, because after getting injected, people observe their faces very closely, very carefully, and sometimes they come to a conclusion that the asymmetry is because of the injection itself. So just to avoid that complication, notice any asymmetries beforehand itself. So again, this is Mer's 5-point glabellar assessment scale. At rest and in dynamic expression, you see from a scale of 0 to 1, mild glabellar frown lines, moderate glabellar frown lines is given a scale of 2, severe glabellar frown lines 3, and very severe glabellar frown lines 4. So Botox will be very effective in treating the 1 and 2 value. In individuals with the glabellar frown line scale 3 and 4, mild lines will still stay after the Botox injections. So this has more of theoretical value rather than clinical. Now, there's a third muscle, which is the depressor supercilii muscle, which mostly is not addressed, but then you still have to know that it exists. Although muscle mass and everything, the original insertion, it varies from point to point, and this is such a minute muscle, but still in some cases, it holds its importance. So it is located, the depressor supercilii muscle is located at the head of the eyebrow. It lies deep to the orbicularis muscle. So when we talk about this region, the most superficial, just beneath the skin, we have the concentric orbicularis oculi. Beneath that, we have corrugator supercilii, the orange muscle, and depressor supercilii, the yellow one, and the procedure. So all the other muscles lie beneath it. It lies deep to the orbicularis muscle on the supraperiosteal space. When we inject, if ever we have to inject depressor supercilii muscle, it is supraperiosteal, that is on the bone. Usually it is 5 mm medial, 2 to 3 mm superior to the inner canthus. Like if ever you have to inject it, you have to go just like this. And its origin is from the bone near medial canthus, runs upwards and parallel to procerus to insert into the skin of the forehead. Now, there are different glabellar injection patterns, but we stick to the 5-point glabellar technique that Allergan suggests, wherein the first point is basically in the midline on the bone, entire depth of the needle goes inside. The second point is we are dealing with the head of the corrugator supercilii, which is lying bilaterally above the medial head of the brow. And here also the injection depth is full deep inside, but not onto the bone, just into the belly of the muscle. And the third point is, again, it lies bilaterally. It is just medial to the mid-pupillary line on both sides. And this is very superficial because here we are dealing with the tail of the corrugator supercilii muscle. So this is basically the standard 5-point glabellar injection technique. So these are the 5 points. The C point is, at point C, we are addressing the procerus deep into the periosteum, onto the periosteum. And at point B is basically we are dealing with the medial head of the, head of the corrugator supercilii muscle. Again, the injection depth has to be deep. And at point A, we have to be very superficial because it is the tail of the corrugator that we are dealing with. So C is for procerus, B is for the head of the corrugator supercilii, and A is for the tail of the corrugator supercilii muscle. So this brings us to the end of this session. I know you will have a lot of questions. So whatever your questions are, you can just post in the messages below, or you can DM me, or whichever way you want to communicate. It is up to you, because here onwards we will start having some queries, some questions, some doubts. So everything is welcome from my end, and happy and safe injecting. And see you in the next video.